Well, good afternoon, everybody. We want to welcome you to our final session on healing from the natural side. Have you all enjoyed this time together all month long? I think we've gotten some great information over the last several weeks, and even though some of the information may not pertain to us directly, we have family members, we have friends who would benefit from the knowledge that we're getting. So don't ever think, oh, that doesn't apply to me. Just think about the people in your life or who God might bring into your life that might need some of the knowledge that you're getting. And just a reminder, we're not giving medical advice. We're giving information. We're sharing information with you that if you have questions, you can consult with your healthcare provider. But in no way are we trying to give medical advice because we're not doctors. Okay, so we're really excited, and also we want to welcome those who are viewing online. Thank you for tuning in today. So today I'm really excited to have a friend of mine. Her name is Mrs. Odessa Reese, and today's topic, and Odessa's going to be discussing with us, is infertility. Infertility. And Odessa has over 20 years experience in women's health and infertility. So she's going to share some of that knowledge with us today. And again, at the end, we'll take questions. And we'll also take questions from prior weeks. So if maybe something came to mind after the other sessions, we'll take those after we finish our questions regarding infertility. And you might think, infertility, that is not something I'm interested in. But again, you might have children, you might have grandchildren. I'm not even going to say you might have a granddaughter or a daughter. Infertility happens to men as well. So it's not just a women's issue. It happens to men as well with issues relating to reproduction. So without further ado, I'm going to turn it over to Odessa, and she's going to share with you some information. Like I said earlier, I may interject and ask a question, but go ahead and share with us some of the knowledge that you've gotten over these 20 years.
Yes, so I've worked in women's health for 20 plus years, with 12 of those years being specifically in infertility. And infertility can seem like a scary word to people. It can seem like a diagnosis, but it is something that can be very well managed. It's something that can be treated, and it's something that, well, I want to say it doesn't mean that you won't ever be able to conceive and grow your family. So in the medical field, when the doctor deems you as infertile, that just means you have had unprotected intercourse for over a year and have not conceived. At that time, that's where that diagnosis comes from of infertility.
So 1 year of having intercourse without any contraceptives. And so at that point, the doctor may say that you're infertile.
Infertile, yes.
Okay.
So the reason why they say that is because the treatment changes.
Okay.
The treatment changes, the medications change, insurance reasons.
Okay.
You know, some insurances do offer infertility benefits. And so when you have that diagnosis, that's when those benefits kick in and your treatment and or medications are covered.
Okay.
So that's why they deem that.
That's interesting.
Men and women both suffer from infertility. It's not just a women thing. Men can be infertile as well, and some of the reasons that cause infertility in women: hormonal imbalance, uterine fibroids or uterine polyps, or simply just having maybe your thyroid is off. That can cause you to be infertile. And as far as our men, low sperm count, maybe the shape of the sperm, how fast they move, which is called the motility of them, and different dietary factors for both men and women. Your diet can play a role in your fertility.
That's interesting. Can you expound on that just a little bit?
Of course. So with anything health-wise, the first thing anyone in the medical field is going to tell you to monitor your diet. But as far as infertility, if you consume a lot of sweets, If you consume a lot of alcohol, smoking, red meat, believe it or not, with further studies, red meat has shown to cause some infertility issues. Those things can play a factor in how well the shape of the sperm or how our hormones are imbalanced with women.
Wow.
Yeah.
That's interesting. I've never heard that.
I know.
Yeah,
I know. We
that's
don't
really
talk
good.
about that.
Yeah.
I mean, you go to the doctor, and some doctors just want to just give you some medicine and wish you the best.
Yeah. Odessa, I think you said you've been watching a little bit, and what I'm trying to do here is we're going to talk about stuff
Yeah.
that people don't want to talk about. Last week we spent a lot of time talking about poop because we were talking about colon cancer. You can't talk about colon cancer without talking about poop.
Yeah,
So
absolutely.
you got to talk. And food, our diets,
yes,
really play a huge role in our overall health and things that we don't even think about. Like I would have never connected those infertility with diet.
Yes.
I would not have thought that.
Yes. One of the physicians I work with, she is huge on diet. She's huge, and I love that about her.
Yes.
I love it about her because, and the patients they're confused, like, eat cabbage soup. What? I just want a baby. But it really does, because our healing is in our food.
Yeah.
You
Wow.
know,
Yes.
and so if we could just start there, because not only when you are trying to get pregnant, when you are finally pregnant, your diet plays a huge role in the outcome
Right.
of the pregnancy.
Wow.
So,
Okay, continue
yeah.
on.
Okay.
That's good.
So I just jotted down a few things that I wanted to make sure I covered, and I did with the women and the men. Women, we are born with a certain amount of eggs. So we have like roughly 200,000 eggs that we're born with.
Wow.
So we get all of our eggs upon birth.
Wow.
And they slowly decline as we age. So between 37 and 40 is when it starts to decline. And then once you hit 40, that's when it drastically declines. And that infertileness comes back up. But working in infertility, I've had plenty of patients that are 40 plus that have conceived and also have delivered successfully with the help of IVF, with the help of in vitro fertilization. That's what IVF is. With the men, some men don't even know. You know, I think men, they got it pretty easy.
I do too.
They have one job in the IVF process.
Right.
They just need to leave us a sample, and then that sample is processed, and it shows us whether the sperm are shaped. The morphology of them is the shape. We are able to see how fast they move. We are able to see how many there are. And so that's the men's one job, but it's a big job. We can't do it without it. So I'm not diminishing you men. But so that's the main part. For the main role in men in infertility is the semen analysis is what we call it. And then part of if we come across an abnormal semen analysis, a few factors that can cause abnormal semen is one, diet again, activity. We see a lot of infertility in men who are truck drivers. The environment, some men that work in warehouses because it's warm, and truck drivers are sitting for long periods of time, and that plays a factor on testicular issues or testicular damage that can also cause infertility in men. Ways to increase, I wrote down a few. To increase your infertility is to maintain a healthy weight through regular exercise and a balanced diet, avoid smoking, avoid excessive alcohol consumption and recreational drugs. Stress, manage your stress levels. Stress plays a huge factor on infertility for both men and women. So practicing meditation or even counseling. Avoid exposure to toxins or any toxic environment. And then if you are younger and you know in the future that you want to have children, then your job is to practice safe sex, because any type of sexual transmitted diseases or infections can ultimately play a role in our future fertility.
So let me just interject
Yeah.
right there. So if someone has dealt with multiple STDs,
Yes.
it could affect their fertility later on,
Yes.
or even
Yes.
current.
Because what it does is it can lead to what we call PID, pelvic inflammatory disease. And so you see that most in young ladies who have had STDs and they recurrent or left untreated.
Okay.
Okay. And that some of them can be left untreated because they just don't know. They think what the symptoms of it is normal.
Mm-hmm.
And
Okay.
so that's how you end up with PID.
Okay. Okay.
Mhm.
Very good. Very good.
Yep. You said something, you asked me, it was something you mentioned with the young lady before with the colon, the young lady that spoke
Mhm.
about the colon. When I was watching that, I was trying to tie that into infertility.
Mm-hmm.
But she had mentioned the testing that you can do
Okay.
to diagnose
Mhm.
or even as preventative measures.
Yes.
And so I often, for infertility, when I worked in women's health, OB-GYN, I would have the ladies do hormonal testing. Just, you don't have to have any issues, but when you go for your annual exam, it's okay to ask the physician for your panel of blood. And at that moment, they can tell you whether there's a hormone called AMH level, anti-Mullerian hormone, and that is through your blood we can look at your egg reserve. We can see how well or how much eggs you're still producing.
Mhm.
And so just basic testing like that can also help in conceiving, can also help in your future planning to conceive, because you have an idea, okay, I am, 35 and I do want children, but my AMH level is, whatever it is, I need to start being proactive.
Mhm.
And so in the infertility world, we have a lot of ladies and gentlemen that are not ready to conceive, but their age is climbing and her AMH level is dropping. And so what they'll do is egg preservation.
Mhm.
So we go through the whole IVF process with them. We retrieve their eggs and we put them on ice. And so when they're ready,
So you're literally saving them for later, for when
saving
they're
them for later
ready.
when they're
So
ready.
they're 35 now, not married,
Right.
doesn't see children in their immediate future, but
Mhm.
concerned that,
Things are
maybe
yeah.
things by the time I'm 40, I might be ready,
Right.
but the eggs might not be there.
Exactly.
So you can,
Exactly.
that's really
Yeah.
interesting that you can retrieve them and
freeze them.
freeze them
Yep.
and save them.
Yep.
And then when you're ready, do you
So when
put them
they're
back, or is that just, is it IVF? Do you put it, IVF is in vitro fertilization. So that's when you put the sperm and the egg together outside of
Correct.
the womb.
Create the
right?
embryo.
Create the embryo and then you
and
insert
put the
it.
embryo back in.
So say when she's ready, and even if it's her husband, she could bring with
Yeah.
his sperm
Yeah,
and
so we
bring it
would-
together.
She says, okay, now I'm married and we're ready to grow our family. So she comes back in and we get her body ready
Mm-hmm.
for what we call a frozen embryo transplant at that time. But we will thaw her eggs and get his sperm and do what we call ICSI, put the sperm inside the egg and create their embryo.
Wow.
And then that embryo gets, at a certain time in her cycle, we put that embryo back inside the uterus and let it do what it do.
And you pray that it
And we
it
pray that it
takes.
sticks.
It sticks.
And
it
in
takes.
2 weeks, she'll be 4 weeks pregnant. Isn't
Wow.
that crazy? So it's based off of the age of the embryo.
Uh-huh.
And opposed to when you were to conceive on your own, we were taught that we know our gestational age by the first day of our last period, right? We miss a cycle and you do the calculation. But when you're going through IVF, your gestational age is calculated by the day of the embryo.
Wow. That's
So we can put it in there, and then 2 weeks later we do a pregnancy test, and if you're positive, you're roughly about 4 weeks.
Well, that's really interesting.
Mm-hmm.
Really interesting. Thank God for technology.
I know.
I know people who are struggling to conceive, and they're like, I'm only going to do it this way. You know, I'm like, they're only going to do it, you know, the natural way.
Yes.
Whereas you can, you know, you can have it done the other way, and it's still,
And it's
you
still-
could have a perfectly beautiful,
Right.
I know children who
You're
were
right.
conceived via IVF,
Uh-huh.
and they're perfectly normal children,
Yep.
you know,
Yep.
and it's a beautiful thing.
It is. It really is. It's amazing.
It's a miracle, actually.
It really
It
is.
really is a miracle
It's
that you can
amazing
do.
how we could take over one's body
Yeah.
and tell it when to ovulate, when not to ovulate, when we, you know, tell our mind when to release eggs, and it's just the whole process is just
Yeah.
amazing to
Yeah.
me, and I believe that's what's kept me in it for so long,
Yeah.
because each case is so different.
Yeah, yeah.
Each case is so different. Each lady, they don't all get the same protocol. The doctors will sit with the lady and give them the reasons of why she could be infertile or what's causing her to have a difficult time to conceive, and then a protocol is built around that condition.
So it's patient by patient.
Yes.
It's not like a set protocol. Let's
Yeah.
talk a minute about IVF, in vitro fertilization, because for some people it's cost prohibitive.
Yeah.
It's very
It's
expensive.
very expensive. Yeah.
You and I were talking earlier, and I believe you said like I had a $20,000 number in mind, and she said, yeah, that was the case 20 years ago, but
Yeah.
now
And
it's more
now
like,
it's more around 35 to 40,000 per cycle. Per cycle.
so if someone is struggling to conceive and they decide to go the IVF route, it's not simple. It's a whole process.
it's a whole process.
It's very expensive, but some insurances are covering
Yeah,
it now.
you have more infertility benefits now.
That's excellent.
You really do.
Yeah.
Some of them are excellent, and some of them will pay for the treatment itself, but not pay for your medications, which can be really expensive.
Yeah.
But yeah, a lot of and you know what, some people don't have benefits at all,
Right.
and they're paying out of pocket
Yeah.
for it.
Yes, I've heard that too.
Yeah,
People pull from their savings, they pull from their
they
pension, their
refinance
401k,
homes.
they pull from their take a second mortgage.
Mhm,
That's how
mhm.
bad some people want to have. I shouldn't say how bad. That's how important it is
Right.
for some people to have children. They would go to lengths,
Yep.
great lengths
Yeah.
to do that, and
Mhm.
thankful for the medical knowledge and the technology that we can
Yeah.
help them make
Yeah.
that happen.
And
for 'em.
I appreciate the group that I work with now, because I've worked with physicians in other offices. They go right to IVF,
Mhm.
and there's no workup.
Mhm.
They just see the dollar and they go right to it. Whereas now, everybody that has been infertile for over a year, they don't necessarily need IVF.
Mhm.
Maybe they need what we call an IUI, intrauterine insemination, and that's just it's less invasive. It's nothing with injecting medications every day. You don't have to come into the office. These ladies that are going through IVF, we see them 2 or 3 times a week. So imagine paying 35 to 40,000 plus for this cycle, and you have to take off of work to come in and be monitored 2 or 3 times a week,
Yeah.
and come in for your egg retrieval and be off that day and the following day. So the whole you do all of this over a 10 to 14 day span. That's how long an IVF cycle takes. And so if we go through all of that and you pay all of that money, and then at the end you still don't get a positive test, it pulls on them.
Mhm. Mhm.
You know, it's a very emotional process, not only just for the patients, but for their nurses as well, because we're with them from beginning to end.
Mhm.
But back to you not necessarily needing IVF off top. Sometimes some ladies come in and we could do some workup on them and just realize that they maybe have a small uterine polyp that has prevented the embryo from sticking this whole time that they've tried. So you go in and you do a simple laparoscopic procedure, and then you wait, and 3 months later you're pregnant. So I say that because I want to encourage, if it's yourself or maybe you have family members that are dealing with infertility to not be discouraged by thinking you automatically need IVF. You don't automatically need IVF to conceive if you've been infertile for more than a year.
So there are other options.
There are definitely other options. Yeah.
A question that I had, I'm just trying to bring it up now. Something I was reading, and I thought it was interesting. It said, this author was saying, think about infertility as a symptom rather than a disease. Like, infertility is not a disease. It's a symptom of something else going on in your body.
Yes.
Like you mentioned, the woman who had the polyp,
Yeah.
a uterine polyp. The infertility was a symptom of that. The disease wasn't infertility, but we removed that, removed that polyp, and she was able to conceive. I've heard that stress is another
Absolutely.
another thing that causes infertility. So again, stress is the culprit. Infertility is one of the symptoms,
Right.
because probably some other symptoms as well,
it's a
right?
byproduct of the stress. There are other symptoms of uterine fibroids. Is a symptom of that can cause infertility. You have endometriosis, which
So
is
those are the actual conditions.
right.
but
Those are your conditions
Mhm.
that can cause you to be infertile, and conditions that can be easily treated. Fibroids are benign tumors that grow inside of the uterus. Some are really small, and some can be as big as a golf ball. And some of the symptoms of fibroid is abnormal uterine bleeding, pelvic pain. You have maybe some facial hair, abnormal labs, or like your estrogen, your hormonal levels can be off. But most ladies that have uterine fibroids, one of the main symptoms is the hirsutism, which is the facial hair growth. So if you see a lot of that, that'll be the first thing that a doctor will test for.
Isn't there another condition that causes that as well? Gosh, another disease. Is it
PCOS?
PCOS,
Polycystic ovarian syndrome.
Okay.
So that's your ovaries are about the size of an almond, and when you look on them on sonogram, you'll see a whole bunch of like little pocket bubbles, and those are cysts. And when you have many of those on the ovary, that's when you have the diagnosis of PCOS, and that too will cause excessive weight gain, excessive facial hair,
and it could
sweats,
cause infertility.
and it could cause infertility. But there's so many women who have PCOS who have conceived. It's manageable.
Yes.
It's definitely manageable.
Yeah. I like the fact that the doctors, the medical professionals have been able to put a time frame and a name on it. So if someone's been trying to get pregnant for a year,
Right.
then they have not gotten pregnant, then they're termed infertile. But because of that, you can start to do, research and do different treatments for that. I also thought it was interesting that you said when we're born, we have women
Roughly
and children,
200,000.
200,000 eggs when we're born. So are they all in the ovary, or are they developed over time?
So they are developed. Each month we get a new set. We release a new set. Each month. That's called ovulation.
Okay.
That's the ovulation part. So when you ovulate, your ovaries are releasing the eggs.
I've been a woman for 62 years. I didn't realize that's the way it was.
Yep, you get we release a new set every month.
Okay.
Some ladies feel it. I don't know if you've had, like, you can have like some sharp pains, or if you're walking, it just kind of catches you off guard. That's the sign that you're ovulating. different vaginal secretions that could be a sign that you're ovulating. Heightened arousals in women can be a sign that you're ovulating. I think that's amazing that that's how the Lord designed us to be, like that when you're ovulating, that's when you're heightened
Sexually.
Sexually.
We're just going to be plain, and I told you, we're putting it all out there today.
You know me. I'm a just.
Yes.
So when you've worked in women's health for all these years, nothing is a surprise to me. And it's funny because when some of my younger ladies come in the clinic and they say down there, I'm like, that is your vagina. Let's say it together. It's okay.
Right. It's okay. It's okay.
So, so that's the ovulation where we release a certain amount of eggs every month at a certain time.
But you were saying it's amazing that God designed us that way, and then during ovulation, a woman's sexual desires are heightened.
Right. And
that's
because
cool.
that's when we are to conceive.
Yeah.
You know, and so and when you're even going through not IVF, but when we're doing what we call a infert cycle or infertility cycle or IUI cycle, whatever you want to call it, we monitor you and we can see it. We can see like, oh, you have so many follicles on this side, and oh, you have so many follicles on your left side. And then when the follicles get a certain size, we give you what we call a trigger shot. And that trigger shot tells those follicles to release those eggs. And then we will do an IUI, intrauterine insemination, that next day or the following day. Or if they're doing a natural cycle, we'll tell them to have intercourse over the next 3 days.
So let's back up a little bit because you're using those terms. I want to make sure people understand it. So when ovulation is occurring, you can see that
on the sonogram.
On the sonogram. So if the spouse the husband has had some sperm set aside, they can go ahead and insert that.
We'll have the once we see that the lady is ovulating, we'll tell her to use the trigger shot. And then we'll say you're going to come back the next day for your IUI. That morning, the husband will come in with his sample. We'll clean it. And when we say clean it, we're picking out the ones that are shaped.
So the
normally.
the sperm sample comes in. You guys clean it, which means you're examining it.
We're examining it. We're picking out the sperm that are shaped well, and we're picking out the fastest moving ones. And we clean those, and we take them out, and then we insert those inside.
And then
hopefully the sperm and the egg will meet and create an embryo.
Yes.
Should become pregnant.
Isn't that interesting? I think it's so interesting to me. So after age 37, the egg production begins to decline.
It begins to decline.
Yeah.
Yes. More so, it used to be 40. I want to say was the age 40 was considered AMH, advanced maternal age. But now I think it's 35. I'm not sure what studies, I haven't looked into that more, but that's when it starts to decline. Not saying you don't have any eggs left, but the production of them what we release each month starts to decline.
Okay. Anything else you want to add? I think
let me see. I think I touched on it. I did your diet. We did the causes, the treatment, fertility. IVF, I will say that in vitro fertilization, although it is cost effective, it's costly, it's really effective. Like our clinic's numbers are really high because of, it goes back to what I was saying about taking the time to learn the case of the woman. But I've had people that are against it because it's not the natural thing to do. But in actuality, it is.
Yeah.
You know, we're not putting anything foreign in you. We're just kind of taking over and asking the body to do what it was designed to do, and helping along the way.
People really need to get past stuff like that because, you know, it's not the natural thing to do. Like, my husband has an artificial hip.
Yeah. Yeah.
It's not natural, it's titanium.
Yeah.
You know, but it's working. It's
Uh-huh.
causing his quality of life, it's given him his mobility back. You know, and I think
Absolutely.
we get so stuck on the way we think it should be done,
Right.
you know,
Yeah.
that we miss the blessing in the medical progression that's
Right.
happened over
Yeah.
the years.
Yeah, it's definitely a blessing. And when I'm with my patients, we pray. Those are the ones that will allow me to pray with them and just reassure them that what God has for them, it's going to be for them.
Yes.
And we're just here as helping hands to him.
Yes.
And, you know, trust the process, continue to believe that he will do only what he could do in this process. But I believe that he gives us things and resources,
Yes. Yes.
you know, to help us with the desires of our hearts. There's so many families out there, so many men and women out there that desire a family, and they stay silent because of beliefs or embarrassment or whatever the case may be. But there's so many resources and tools that can help you grow your family.
Yeah, that's excellent. Excellent. One of the things I was going to mention is, you know, there's a book, you probably haven't, I mentioned it before, but sometimes people are well-intentioned, but they say things they shouldn't say. And the book is called The 30 Dumb Things That Well-Intentioned People Say. And, you know, people say things they shouldn't say, like to ask a young couple when they're going to have children
Yeah.
is not appropriate.
Yeah.
It's not appropriate. Some people are struggling
You never know.
to have children. You don't know. So to say, when are y'all going to have babies? Y'all need to get busy
Yeah.
and have some babies.
Yeah.
You don't know if they're struggling with
Right.
infertility. You don't know if when they walk away from you, if they're going to bust out in tears because you're saying, you need to go ahead and get busy and have children. Jerome and I, we waited 8 years. We got married young. We got married at 22 and 23. We waited 8 years on purpose. We weren't having any trouble, but we waited 8 years on purpose. But there was this one woman who would come to his store where he was working, and she would say, when are you and Lisa going to have babies? Y'all need to go ahead and make some babies before you can't have any.
Gosh.
That's what she used to say. You know, you need to get busy. You need to have some babies.
Yeah. Yeah.
You don't
do
say
that.
that.
Don't
You
do
don't say
that.
that to people. You don't do that to people. And some people actually, believe it or not, don't have a desire to have children.
Yeah. Yeah.
There are couples that don't have a
Yeah.
desire to have children. It's okay.
Yeah.
It's okay.
With our last one, well, all of
Tell
our
them how many
big-
children you have, Odessa.
my husband and I, we have 5 children. We have 5 children.
They're beautiful children.
And they were planned. They
Uh-huh.
were all planned.
Uh-huh.
And so we did 1, 2, 3, and 4. And then I came up with this brilliant idea. I had this bucket list that I was going to do a fitness competition, y'all. And so I did a fitness competition. And in those fitness competitions, you're taking so many supplements. Your body fat is dropping drastically. You're working out all day, every day. And that played a role on my hormones. And so we decided to have number 5. And because 1, 2, 3, 4 came so easily, you know, we could think about it and be pregnant. But it took
Not
us,
really.
Right. But it took us 2 years.
Wow.
Yeah, it took us 2 years to conceive Truth. And I was even working in infertility. I was working this is in Texas. I was working in a clinic there. And even being in that environment, I forgot where I worked. I forgot my knowledge. I was so focused on what is wrong with my body.
Yeah,
Like,
yeah.
I've done this. I can do this. I know I can do this. But when it took us 2 years to conceive him, going through treatment was not my first thought because you've done it before. I've done it before. And in the infertility world, that's called secondary infertility. You have primary, where you've never had any children, and then secondary is where you've had children, but now it's hard for you to conceive again. So I was dealing with secondary infertility. And I dealt with, it was stressful. I felt like I was only being intimate with my husband with the goal of having a baby. That was it.
Yeah, yeah.
And that really it doesn't help. It doesn't help the marriage. It puts stress on your marriage. I knew the numbers of what it would cost to go through treatment. That was stressful. And I just had to take a moment like, okay, let me listen to my body. Let me reevaluate the difference between what my body was like when I conceived our first 4 children to now. What did I do differently? What has changed? I did change my diet. I went plant-based. So that played a role. I did all of the supplements for the training. That played a role in my fertility. My body fat percentage dropped quickly and drastically, so that played a role. And so I really had to take the time to just get out of my feelings for a moment and use my knowledge. And then I started to do the things, doing my hormone testing. The doctor that I work for, I would ask him to scan and just say, can you just tell me if I'm ovulating, or maybe I need to wake my ovaries back up, and did those things. And do you guys, so I went through all of the process.
What was your age at that time?
I was, how old am I now? 38 when I was trying.
Okay.
Yeah. I think I'm 39. 38 when I was trying, maybe 39. And so I didn't do the IVF route, but I did like the natural infertility route. So I would do like the pill called Clomid or Femur that will help wake my ovaries up and have me release more eggs and things like that. Didn't work. And so I finally said, okay, let's just do a exploratory laparoscopy. I wanted him to see what was in my uterus that could be causing. And do you guys know that I had what they called retained tissue from my previous baby still left in the uterus? Even though it was like a centimeter or 2 centimeters, that small of a tissue prevented me from getting pregnant.
Wow.
For 2.5 years.
Wow.
And once we had that removed, within 3 months we were pregnant with Truth.
Wow. So you asked him to do the laparoscopic procedure to look into your uterus.
Yeah, everything else was checking out. Like I'm still, my AMH level was fine. I was still ovulating. You know, my cycles were back normal and all those things. And he said, we agreed. He was like, well, let's just do what they call an exploratory. Let's just see if there's anything in there that could be preventing, because even on the sonograms, you couldn't see it. And so when he did, he said, I did have retained product from previous pregnancy. That was 5 years before.
Wow. Isn't that interesting? So many interesting things. Yeah, so if you know somebody, you know couples that are young and married, or not even young and married, just married, don't ask them when they're having kids.
No.
It's just, I mean, we're used to, the society has changed. That kind of stuff used to be acceptable or deemed acceptable or appropriate. Well, this was almost 40 years ago for us, or maybe 35 or whatever. And people were asking us that. We got that a lot. That one woman, she always would badger him about it. But we would get that all the time. Like, how come you all don't have kids? When are you going to have kids?
Yeah.
Oh, you should have kids. You shouldn't have kids.
And people ask that even when people already have kids. Like I was getting that. So y'all not going to have any more? And I'm like, I'm trying. You know, trying to hold back my tears.
Right.
You know, because you never know what people are going through, and they could really be trying. And it's a stressful process.
Yes.
And like she said, some people just don't want kids. And then when we ask them, when are you going to have kids? It makes them feel like they're wrong for not having a desire to have children. Yeah. So I tell my children, and I was telling them last night, I give them this acronym of, I say, think before you speak. And think is it thoughtful? The H is it helpful? Is it inspiring? Is it necessary? And is it kind?
Oh. Can you say that one more time? Think before you speak.
Think before you speak. Is it thoughtful? Is it, what did I say? Helpful? Thank you. Is it helpful? Is it inspiring? Is it necessary? And is it kind?
Yes.
Before you say anything, Is it necessary? That's the bigger thing. Is it necessary? Because if you did ask them and they told you, what you going to do with that information?
Yeah.
Are you going to say, I'm prepared to pay for all of your labor and delivery fees,
Right.
or I'll buy diapers for the first year,
Yeah.
or, what are you going to do with that information once I
right.
tell you the answer?
Right. And that goes across all lines, just period.
Yeah.
Think and remember that acronym,
Think.
because a lot of times our intentions are good, but we're saying stuff that really is inappropriate. Really, very good. Anything you
Yes.
want to add before we open up to questions from our audience?
No, I think that's it. We covered a lot. That was a lot. I gave y'all a whole IVF session in what? What takes months to uncover and years to uncover. So I know that was a lot of information.
Yeah, but you never know who needs this information, who you're going to bump into, who could use some of this information. So thank you. Thank
You're
you for sharing
welcome.
with
Thank
us
you for
today.
having me.
Thank you so much.
Thank you.
Does anyone in our audience have a question that you want to raise? If you do, can you come to the microphone?
Hello, thank you. Thank you both. This isn't a question as much as it is another cause, which I've experienced with my daughter. Another cause is chemical for young ladies and men who go through cancer treatment
Yes.
that aren't able to produce eggs, and especially when they go through so young that they have no opportunity, or they've had to go through so quickly
Yes.
because they didn't have a chance to freeze
Yep.
their eggs. So that's another reason not to ask young people,
Right.
young
Absolutely.
couples,
Yeah.
are you going to have a child, or when you're going to have
Right.
a child. And it is very, very expensive, to the point where I really think that the whole process put my kids behind their peers in moving forward with their, financial married life, because it cost a whole lot.
Yes.
But I do want us as a people to think about that. If you're going through any kind of treatment, find out if there is time to freeze eggs,
Yeah.
and talk about that and be,
Yeah.
right on top of that.
That's very good.
Absolutely.
So
I'm sorry.
go ahead.
I do have a couple of patients that I have been recently diagnosed with cancer that have come in for what the egg preservation we talked about earlier. So they haven't had any children, or maybe they have had children and they know they want more, but then they have this new diagnoses of cancer. And so they'll come in and we'll do the whole IVF process with them to retrieve their eggs, so that when they're healed from cancer, they can resume their family planning. So that's a good point.
Chemotherapy, many times, I don't know if it's all the time. Is that Nurse Freddie back there? I don't know if it's all the time, but chemotherapy does put women into menopause if they haven't already. Like that happened to me. I hadn't gone through menopause, but after, gosh, it was my first treatment. Basically, sent me. I never had another period after my first treatment, chemotherapy treatment. So you can see how, especially someone really young, if they get a cancer diagnosis, hopefully it's in time to. They have enough time to preserve those eggs if they want to have children later. Thank you for bringing that out. Yes, Ms. Gwen.
So you talked about treatment for women, but what about if the problem is for the man? What do you do for that?
Well, see, they got it. I told you they got it easy. They're
Well, if they have low sperm count or something, is there something that stimulates?
There's
that?
some vitamins, there's some supplements that can help, but there's is more so lifestyle change. We've had guys come in and leave us a sample and they have 0 sperm. So it's nothing that we can do for that. At that time, the couple is considering donor sperm. But yeah, the only thing for men right now, and urologists may know more, may know of more treatments for whatever their diagnosis is, but over on the infertility, we refer them to a urologist, or two, there's different supplements that they can take. And then we, of course, talk about the lifestyle changes. Yeah.
Thank you for that question.
You were amazing. I've been a
Thank
nurse
you.
for a long time, and I sat here and learned so much.
Oh, it's
And
amazing.
anybody that, just watch this again, for anybody, for your children. I have someone that's dear to me that's went through the process all the way through that you talked about, and I watched them, and sometimes you have to watch in silence. The emotional part is so big. That's very, very big. When you said the trigger shot, can you talk about that a little bit more? Is that the needles that they have to take once they are ovulating?
Yes. Well, the trigger shot is an HCG hormone.
Right.
And so that is the shot that hormone triggers our mind to tell the ovaries to release.
Okay.
Now that's a separate injection from IVF.
Right.
The IVF injections are follicle stimulating hormones. Those are hormones that are growing the follicles that we grow in our ovaries. So as we start stimulation meds, we now see that lady every 2 or 3 days, because we don't want her to what we call hyperstim, overstimulate her, where then it causes or it can damage the ovary. So we watch them very closely through that, but you have drugs that the like Follistim or Gonal-F, those are just to name a couple. Their job is to grow the follicles so that we can retrieve the eggs.
So is that trigger shot in that first process that you're going through, and maybe you failed that process, and then you had to get to the IVF process?
Exactly.
Okay.
So some insurances they require that you do maybe a certain number of IUI rounds before they will pay for IVF. They want to see if you can get pregnant with just us, giving you Clomid or that trigger shot. I would say most of them is like between 4 to 6 is what I've seen. They want you to do 4 to 6 rounds of the of the IUI cycles, and then they'll pay for IVF.
And I thought it was very interesting. I learned too from you today about secondary infertility, because I couldn't understand why this was happening to this person, healthy, normal child, and then trying and could not,
Yeah.
and had to go through this process on their second time around. Nice, healthy baby, praise
Yep.
the Lord,
Yep.
through it. So
Yep.
you did hit on that. That is so important, because it does work. And then again, I like what you said about people don't educate themselves on it. I sat here and got a wealth of knowledge. This was amazing. This was really, really warranted for all of us to hear, to take back to someone that may be going through it. Because the emotional support is so important, because I think they kind of go into themselves when they try so many times, and then you get pregnant, and then you don't hold the baby too. They go through that part too.
Yeah.
So why, if you do IVF, and this is my last question, so once you do the IVF, you're good, you've had the eggs retrieved, they're there, and then this, you do the implantation. So it's before you get to that part, the first part where you went through, and then you have become pregnant, and you're doing good, and then all of a sudden you go back again and there's nothing there. Is that before the IVF process?
It's after, right?
What's the help me understand that you're saying if they lose the baby,
Yes.
is that after
After IVF.
IVF?
After IVF.
Yes. So IVF does not guarantee a successful 9-month pregnancy.
Okay.
It does not. It doesn't. Some ladies do embryo testing before we put it back. They send their embryos off to the lab to do genetic testing, and some come back abnormal, and we report that to the patient, and it's at that patient's discretion if they want to still implant that. But let's say they have the embryo comes back normal, and we implant that. That still doesn't say that you won't have a miscarriage. That
Okay.
just states if you do have a full-term pregnancy, what we tested for, the baby won't have those things. And even then, after we do testing and we get you pregnant, at a certain time in your first trimester, we're still asking you if you want additional genetic testing. You'll notice around 20 weeks, they do what is called an anatomy scan. And at that time, there's actually an ultrasound looking at the baby, looking for any neural tube defects, and that's something that could have been not tested on the embryo. I guess my point is saying that there's not one complete testing that will say you are going to have a healthy long-term pregnancy and child.
Okay. Final question, your team, do they have like someone like behavior health involved? Because it is an emotional process. So that part of going through all of it, because you do all the things you said, this was amazing. Do you have that as part of your team? Do you think that's something that's good to have as part of your team?
Like
If
a
you don't-
therapist or counselor?
Yeah, behavior
mental
health, like on
provider?
your team, counseling. Do you recommend that, or I know you can't recommend, but is that part of the team, the healthcare team? Like you said, you work with a bunch of good people
Yeah.
to walk that person through that process.
No, there's not a team within this clinic, but we're advocates of the counseling, because it can be a very emotional process. I had a patient yesterday. She came in and her blood pressure was high. And I was like, why is your pressure? What's going on? What's happening? And she said, well, I just got back from counseling. And I said, oh, you should have led with that, because it can be very, and the reasons why she's going is because this is not her first round, and she's struggling on if she should continue to try this thing. So she said the counselor is really helping her with it and helps her along with it. The clinic I worked for in Texas prior to this one, we would, before they started treatment, they had to do counseling. That was one of our prerequisites,
Good.
and
Very good.
I appreciate that.
Very good. Thank
Yeah.
you.
You're welcome.
Yeah, I know. One person's coming to my mind right now who they were really trying to have a baby. She had 7-8 miscarriages, but still was pursuing pregnancy, and ended up they conceived, but I think the whole process put so much pressure on the marriage. The marriage didn't work after that. So they split up after that, because like part of the in vitro process, and you can correct me if I'm wrong, just from a little research that I did, like you ovulate, well, it's not in vitro, but the fertility process, you ovulate, and then you're supposed to have sex day 2, day 4.
Yeah.
I mean, it's like a schedule.
Yeah.
And it takes the spontaneity out. It takes, and it's like, okay, we're having sex. We're having sex to get a baby.
Yeah.
We're not making love. We're having sex to get a baby.
Yeah.
And that puts pressure on the marriage.
Yep.
So I love that idea of having, some kind of therapy
Yeah.
as you're walking through
definitely need
this
it.
for the couple, not just for the woman, but for the couple
Yeah,
together.
absolutely.
Because that's a lot of pressure.
There's a lot, and that you start to point fingers at each other during the process of, I told you we had to do this then, and you missed the appointment, or if he can eat one cheeseburger, and that is the whole reason for the
Yeah, right,
for
right.
infertility.
Yeah.
So it's what I tell you guys. It's an emotional process. It's more than just a financial strain, because for some it's a strain, for some it's not, but it could definitely play a toll on the marriage. And the group that I worked with before, when they wanted a prerequisite is to go through counseling before you started the IVF, you'll be surprised of how many families was like, you know what, we're not ready for this. Or because we wouldn't move forward unless we got clearance.
Yes, right. Wow.
Yeah, because you're this if it's the lady, she's already unstable emotionally, and then we're getting ready to put her through this testing and then increase her hormones by all these injections, and now she's even more unstable. Now she's pregnant, and she doesn't know how to handle those hormones that come along with pregnant, and then she has the baby. Now you got postpartum depression, and it's just like a domino effect.
Right.
And so you have to, the desire of having a child is true, but I always tell people just to play it out all the way through. Like especially my younger girls, and this clinic doesn't necessarily you don't have to be married to go through. So some of these girls are coming in and they're just in love, you know. And I'm like, this is a whole child that's gonna keep going even if y'all stop going.
Right,
He's gonna be in your life forever. So I'll ask those type of questions to them, just to make sure they're ready, because
it's a whole life.
toll.
Very good. Any other questions before we wrap up? Any other questions at all? Well, I have certainly learned a lot today.
Well,
I've
thank
learned
you
a lot.
for having me.
I didn't realize the part that diet plays.
Yeah.
It plays such a huge part in every area of our life. And I think just generally we need to do better as people with that, you know, thinking about what we put into our bodies and how it will affect us.
And then all of our foods now are becoming more and more processed,
Yes.
which has more and more hormones in it. And that's just going to imbalance our hormones even more, you know.
And especially, you're saying that, you think of little girls now who used to be
Starting those
little
cycles
girls.
early.
And look how big our little girls are now. It's the hormones in the food.
And they're starting their cycles early.
They're starting their cycles early, 9, 10 years old. It's a lot of this has to do with the food. You're eating processed food, like, you know, here I go again, right? And I love a Big Mac. I still love Big Macs. They don't like me, right? But you think about this stuff that we're eating, you have no idea what's in it. And if kids are getting so much fast food and they're developing prematurely, and it's throwing their bodies off, it's throwing their cycles off, it's throwing things off. And we just have to be just careful. Just be more
more mindful.
More mindful.
You don't have to cut it out completely, but definitely limit it.
Yes.
Definitely.
Yes.
I would say, and like you said, we're not giving medical advice, but my first go-to with myself and my family, if something has come up, my first thing is, what did you eat? What did you consume? What is your diet like? I noticed real quick, and I know we're gonna close up. I noticed one of my sons, he was coming home from school. I was homeschooling them for a couple years, and then one year I let them go to school. And he was coming home from school, and his body odor, I was just like, bro, what's happening? And I immediately thought, it's your food. It's what you're eating at lunch. It's the processed food that they're feeding you there. Because before that, we were taking lunch, and you were at home, and I was cooking, and I didn't notice all of that. But I'm only saying that because that just proves my point of is what we consume. It comes out, and it affects the way our body functions. So you don't have to cut out the sugars and the processed food, because I love a good processed something, I'm sure, but just limit the intake.
Yes.
You know.
And it'll just help our bodies all the way around, not just where fertility is, but just our overall health.
Yep, absolutely.
In general. Well, thank you, Odessa.
Well, thank you.
It was great to have
This
you
has
with
been
us
great.
today. So thank you so much.
You're
And I know
welcome.
our audience appreciates it, both in
Thank
here
you guys.
and online. So thank you very much. Well, be sure to come back next week. We're going to resume Healing School. The authority of the believer is what we're going to be talking about. In Healing School, we have a great group of teachers who are going to be bringing the word of God concerning healing and what our authority is as believers. But we want to remember, we're going to marry the natural side and the spiritual side. So coming up, starting again next week, is going to be the spiritual side. Going back to the spiritual side, because the word of God is true, and it'll work if we work it. Amen?
Amen.
All right. Well, thank you for joining us today.